Ladies and gentlemen, esteemed nursing students, faculty members, and honored guests, today I stand before you to discuss a crucial concept in the realm of nursing and medical care, the rule of nines. This is a simple yet a profound principle that plays a significant role in assessing and managing burn injuries. Okay, so as future nurses, we need to understand the rule of nines, which is very essential in providing effective and compassionate care to patients who have suffered burns. So we can define the rule of nine as a method used to estimate the extent of burn injuries and determine the appropriate treatment and management strategies. The rule of nines provides a quick and practical way to assess the body surface affected by burns, which is essential in guiding us in fluid resuscitation, wound care, and the overall patient care. Remember, a link will be popping up on how to use the Parkland formula that is essential in fluid resuscitation. So let's look at the components. And when you're talking about the components of the rule of nines, we say that the body is divided anatomically into the different regions. Remember also a link will be popping up on the different regions, okay? Let's start with the first one. So you do what? You divide the body. Okay, so you divide the body into those different anatomical regions. Okay, and then these regions are multiples of 9. So this normally simplifies the assessment process. The first anatomical region is the head and the neck, and this one constitutes 9% of the total body surface. It will include the face, the scalp, the ears, and the neck. The upper limbs are the next, okay, followed by the chest and the abdomen, the upper back, lower back, genitalia and the perineum, lower limbs, okay. So from that one now, we'll say that the entire head and neck will constitute of the 9%, followed by the entire right arm, 9%, entire left arm, 9%, the entire anterior torso, yeah, the chest, the abdomen will consist of the 18%. The entire posterior torso, the back, upper back, lower back will be consisting of the 18%. The perineum, the groin, will have 1%. The entire right leg and the entire left leg each will be consisting of 18%. So if you add the total percentage, you're supposed to give us 100%. Okay? So we have the entire neck, entire right arm, left arm, entire trunk, groin, entire right and left arm. Okay? So you can be able to see the anterior part and the posterior part. So this is what we refer to as the rule of nines. Okay, so it's important for us to understand the rule of nines because of several reasons. Number one, it's important in initial assessment, which is able to help us calculate the exactly or estimate the extent of the burn. It's also important in fluid resuscitation, and we'll be able to see how we can incorporate the burn surface area in the Parkland formula. Also, it will be important for the wound care planning so that different areas of the body have varying degrees of sensitivity and healing potential. So the rule of nines will aid in planning wound strategies based on the severity and the location of burns. And lastly, it's important for communication and documentation so that effective communication among healthcare team members is vital. So by using the rule of nines, it allows us for clear and concise communication regarding the extent of burn injuries, aiding in coordinated care. So in summary, mastering the rule of nines is fundamental skill for nursing students embarking on the journey to become compassionate and knowledgeable healthcare providers. So by understanding this principle, you will be better equipped to provide effective care, comfort, and support to burn patients during their time of need. As you continue your education and training, Remember that your commitment to learning and your dedication to applying this principle will play a key role in improving patient outcomes and making a positive impact on the lives of those you serve. Thank you so much, and let's practice the rule of nines.